Marijuana continues to be the #1 used illicit drug in the United States. According to the most recent National Monitoring the Future survey, 1 in 15 high school seniors reported smoking marijuana every day.
So Scott, after everything you heard today, I have to ask you, was it worth it? Scott, I asked you a question.
Well, I have been pressured to use marijuana. I've been offered it by friends, teammates, people just around school that I don't even know.
Some kids they brought marijuana to school, I guess. They were like, hey, you want to do this after school or whatever? And I was like, that was the first time I ever saw it too. I was like, no, I don't know, I don't even know what that is. Like, I was kind of scared. I don't want to try something like that.
The first time my friend ever asked me was we were at her house. It was just a regular Saturday. Her mom went to work, and she said, do you want to go take a walk? And I said, okay. And so she pulls out a little rolled up thing, and I was like, what's that? And she's like, oh, it's just marijuana. Do you want some? And I was like, I'll pass.
They usually just offered it kind of in, not even very subtle. Like, they just kind of said, oh, do you want a hit, or oh, you want a joint? And they weren't too, it wasn't like it was a big deal. Like, it was like that they were offering me a cookie, like it wasn't like a drug.
Hey Scott, is that you? How was the party?
Yeah, it was good.
When you're reaching for marijuana or any drug of abuse as a means of coping, you're effectively stifling your own psychological development. You're stopping the ability for you to learn skills to deal with everyday stress that you can use the rest of your life. You're setting up a situation where you will have to appeal to some chemical coping skill to simply numb the situation rather than dealing with the situation.
Parents need to know what's going on with their children, where they're going, who they're going to be with, what kind of things they have. And a lot of people, young people, believe that those are invasions of privacy. But when a parent's paying for a cell phone and you have a kid that's texting about smoking weed, I think it's absolutely that parent's right to know what they're saying and what they're doing.
Hey Scott, how was your day? Where's the Scott? Did you pick up your brother? Scott, come on.
Marijuana use has really increased with youth, and a lot of that I think has to do with Prop 215 and the medical marijuana program, where people are talking about it being medicine now and not an illicit drug. And so you see people looking at it like if they were taking aspirin or any other legal substance. You see people talk about, especially young people, they need their medicine, and really it's a euphemism.
So parents need to be aware of changes in their child's behavior and different items they may find around their room. This could include marijuana paraphernalia. They may find pipes, they may find electronic smoking devices or rolling papers. Other items could include posters or any association with the marijuana culture, such as leaves on t-shirts or on binders. They may also find that their child has red irritated eyes, so they could find eye drops in the room. Other things may include changes in the smell of their child. They may notice that their child smells differently and may find that they're hiding or masking the smell with things like Febreze or incense. So just basically looking around and making sure that they notice those differences in their child.
The fabulous ones. because, you know, here's a word, it's fight, which is a German word, and its equivalent is battle. That was being spoken. It's now
Working memory is defined as your ability to hold a thought for a short period of time. So what does that mean? It means if you're using marijuana, they found that you're not able to take one thought and hold it even for a few minutes at a time.
Scott, Matt, wake up. Now, what William didn't bring along with him, what the Normans didn't bring, was that
Marijuana creates an amotivational syndrome. You lose your motivation. Well, that effectively is going to change how you function as a family member. It's certainly going to affect you when it comes to your occupation or your education.
What's going on, Scott? You used to like doing this.
I don't know, just get off my case.
Behavioral effects, in other words, how you respond to stimuli in a normal interaction with people.
Scott, what are you doing? You're going through my purse. What's up? I'm doing it. What's up with you? Hey, you're starting to worry me. What's going on with you? Come on. Scott, I know to talk about this. I'm really worried about you. We can work this out. We can talk about it.
I haven't even touched on the legal ramifications. If you get in trouble with the law because of your marijuana usage, sales, whatever, then that's a financial drain on the household. It's an emotional distress within the household. It's going to effectively remove you from the household if you get incarcerated. So those are certain things that people never think about. We live in a society of me, the philosophy of me. So we generally don't think about how our actions are going to affect others, but it can have a huge effect.
No, it's not mine. So bad, man. Hold on, stay right there. There's an available VP.
Rumored to be using marijuana, I certainly wouldn't socialize with them. It's one of those things where I think it all of a sudden starts putting you in a category and labeling you with consequences that you don't foresee. And then there are also legal consequences of being arrested, going through the court system, possibly facing jail time, losing your driver's license, your insurance rates going up. All those things become a big deal because of one joint or wanting to get high.
Scott, I asked you a question. Was it worth it?
No, it wasn't. I would say my personal reason for not using marijuana, one of the main reasons, I have a couple of reasons. One of the main reasons is because of my mother. My mother, like, in her eyes, she still sees me as a little kid. She sees me as a little baby. She talks to me like I'm a little kid sometimes too. And if I were to ever do these drugs and she caught me and maybe I went to jail or something, I know it would probably break her heart. She wouldn't see me as a little kid anymore. She'd probably see me as this teenager that goes around and gets in trouble and does drugs. And I don't want to look like that to my mom.
My name is Isaiah Gonzalez, and I perform above the high.
My name's Nicole, and I perform above the high.
My name is Christopher Gonzalez, and I perform above the high.